Welcome, welcome, ladies and gentlemen, and thank you so much for joining us this Friday evening to have a topic that concerns you and concerns me as well. This evening, we talk about the Universal Periodic Review, and I do not know if you probably heard about it, but if you've not, in this conversation, you'll hear us use a lot of UPR, and we just want you to understand that as we set the pace for this conversation, it is a unique process under the United Nations human rights system, and it does involve the peer review of the human rights records of all United Nations member states every single 4 years, and is purely a voluntary process, and Uganda is part of that. So we want to assess how this mechanism that happens every 4 years is progressing now that as a country, as the world, we've been dealing with the COVID-19 pandemic, and we do have a great panel of speakers to help us understand what UPR is all about. And also, you as a citizen, what do you have to do to be part of it, to see that your human rights are respected? So I'll start immediately with the guest speakers that we have, and I want to start on my immediate left, Mr. Abdul Karim Muhumza. Thank you so much for joining us today. I do appreciate you creating time and making sure that we get this conversation going. We know you are the Senior Program Officer, SEHAT, which is also a sponsor of this show. We want to say thank you for making this conversation. Welcome, and thank you for joining us.
Thank you, Sarah.
I'll move on right away to Dr. Betty Chadondo, who is the Director of Family Health National Population Council. Thank you so much for joining us this evening.
Thank you, Sandra, and good evening, viewers.
And I do want to move on to Mr. Robert Scheringer, who is the Executive Director, National Coalition of Human Rights Defenders Uganda. Thank you so much for joining us.
Thank you, Sandra, for hosting us, and good afternoon, viewers.
Thank you for being here. We'll also end with Priscilla Nyarugoye, who's the Senior Human Rights Officer, and you are the head of the Vulnerable Persons Unit at Uganda Human Rights Commission. We are curious to hear your version of how the UPR is actually working for member states, of which Uganda is part. Thank you so much for being here.
Thank you, Sandra. You're welcome.
Now, for you who's watching us, you're probably wondering, how do you get part of this conversation? We do have a hashtag. It is UGUPR2022. If you have any comment, of if any of the guests have something they've said and you want to get some clarity, do send us your thoughts on our social media platforms, but also use the hashtag NTV Uganda on Facebook and NTV Uganda on Twitter. I want us to dive right away into this conversation. UPR, Universal Periodic Review, what is it all about? And I want to pose this question all the way to Mr. Robert Scheringer. I know we did host you about 2 months ago, but I know there are viewers who probably did not watch the show and who did not get a clear idea of what UPR is all about. And there is a person out there that is hearing this for the first time. What is UPR?
Thank you, Sandra. The UPR is basically what we call the Universal Periodic Review. It's a mechanism in which countries of the United Nations accepted to peer review each other. Peer review each other means that you advise or tell me what you're doing in your country in as far as protecting and promoting human rights is concerned. So it's a peer review mechanism that was established in March 2006 by the organ of the UN known as the General Assembly, creating a body called the Human Rights Council. So in the Human Rights Council we have 47 countries, but the whole United Nations system is composed of 194 countries.
Yes.
So all these 194 countries are peer reviewed by their fellow countries. And the UPR is a 4-year cycle. So Uganda has appeared there twice, and we're now going for the 3rd cycle, which will be in 2022 rather, because we last appeared in 2016. Now, because of the COVID pandemic, there have been some adjustments. So we are going now to Geneva as government, because it's a state-driven process. When we say it's a state-driven process, it's governments talking to fellow governments. So the government of the Republic of Uganda will be going to Geneva to give an account of what it has been doing in terms of fulfilling its pledges, its commitments, which are voluntary in as far as protecting and promoting human rights in its countries concerned. Then the other countries will be able to listen and then also give recommendations. Now, when a country gives a recommendation, because countries here are all treated equally, the United States of America is treated the same way as a small country like St. Lucia or Somalia or DRC. They are all treated as equal partners. So you can make a recommendation to the United States of America. The United States of America can make a recommendation to in terms of fulfilling human rights. You are free to accept or support that recommendation, or you take note. To take note, you say, yes, I've had the recommendation, but I may not be ready to implement it. But when you say I've supported, it means you've accepted it. And therefore, in the next cycle after 4 years, when you're going to report back, you must be able to tell us, did you implement that recommendation that you took, you accepted? So basically, that's how the UPR operates.
We're looking at conversations that we had back then in 2016 where Uganda adopted some recommendations and dropped some. I want you to speak to us on those. Why did we as a country drop those recommendations? Could they have affected us moving ahead? And for the last, say, 4 years, how have we been performing? We did have a general election. How are we doing? Where is the progress at the moment?
Well, in terms of reporting on the implementation, I think some progress has been made. So there are some recommendations that have been implemented, and there are those that have been partially implemented, and there are those that have not been implemented totally. So the state will be giving an account on why some recommendations have not been implemented, while others were implemented. So as I indicated to you, it's a state-driven process. Yeah. And then my colleagues who are from civil society will also be giving an account of what they think the state has been able to implement and what feels has not been. And therefore, in the UPR, we have 3 reports. The state report, which is reviewed, that's the Government of the Republic of Uganda report. Yeah. And then we have another report provided by civil society, what is called the stakeholders report, inclusive of also the National Human Rights Institution or the Uganda Human Rights Commission, and then the UN country team based in Uganda, headed by the United Nations resident coordinator, also present their report as a country team in as far as how they think Uganda has been able to fulfill its human rights obligations.
Well, thank you so much, Mr. Scheringer. I will be coming back to you because you come from the side of human rights defenders, and we want to understand the general election where we did see some violations. Did we register these? Are there plans to actually work around ensuring those that were guilty are punished? It's something that I'll be getting back to you in a bit. But I want to move all the way now to Mr. Mhumza Abdul Karim. You're from SRHR, and SRHR, at least we know it works closely with ensuring health rights of citizens. If you were to state for us the current state, how are we doing?
Thank you, Sandra, and once again, good evening, viewers. In terms of the health rights, and yes. I want to again emphasize that as the Center for Health, Human Rights and Development, we've not been working alone in this UPR process. We've been working with more than 35 organizations who are interested in issues to do with improving health care in this country. And we were able to submit our last reports in 2016. We submitted the report on the right to health, but also able to submit a specific report on sexual reproductive health and rights, where we are putting forward to the government areas where they need to focus in ensuring that there is improvement in health care in terms of financing. And in 2016, the government committed to several interventions, and one of them was progressively increase financing for the health sector through the health sector budget and the development plan, but also they committed to improving the situation of maternal health. In our country, the maternal mortality rate is still high, 336 live deaths we are experiencing per 100,000 live births every year. And then the government also committed to improving other areas related to health, like combating HIV and AIDS through ensuring they are doing programming that is against discrimination and stigma for a person living with HIV and other elements. So we want to, first of all, commend the government of Uganda. There has been a bit of progress, and for us as the Center for Health, Human Rights and Development, we use different approaches. We use dialogue, but also we use other engagements like litigation. 9 years back, we went to court, and one of the issues we are trying to raise is that why do we lose many mothers per day, 16 mothers being lost per day. And just a few months back, the High Court released a positive judgment. It was a landmark judgment for us after 9 months and after 9 years, where they made clear recommendations, declarations to the government of Uganda to improve maternal health care. And we are lucky that the courts of law gave positive declarations, and also want to thank the Minister of Health. We've been working with the Minister of Health over the years, and we are happy that they've taken up initiative to improve maternal health care. Currently, they are doing weekly maternal health audits, and this really improves to understand from the grassroots and the health facilities where are the gaps, why are we losing many mothers. But also, one of the challenges where we think the government has not yet put enough efforts in terms of financing for the health sector. While government committed in 2016 to improve, progressively improve to meet the 15% of the budget declaration, which they committed to, for the last decades, years, we've been stagnant around 6 to 8% of the sector budget. And when you look at the priorities for this country in terms of the budget, national budget, health is not even in the first 5 priorities of this country. And we still wonder why. You've seen in the COVID-19 pandemic, it has been a classic example that we need to focus and put more resources in the health sector. But this has not yet been realized, and want to emphasize again that the government needs to look into adding more resources to the health sector, because this will help to improve many other issues, maternal health, and also the other element which the government committed to put in place strategies, policies, and different interventions to improve access to sexual reproductive health and rights for young people. But you find that currently we are still having many policies that the government has not given priority. For instance, the school health policy for the last 20 years has been in the making. Currently, they have done efforts to the regulatory impact assessment, but Cabinet has not looked into this. There's adolescent health policy. We have the SRHR policy standards and guidelines, which are supposed to be informing access to healthcare services specific to SRHR services. So we want to again call upon the government to have this as priority. You will see that in the whole world, the government of Uganda is one of the governments during COVID-19 which has had children out of school the longest.
True.
And this is not something good for us as a country. But we also see how many challenges we've gotten. Teenage pregnancies have been the highest in all of the sub-Saharan Africa. Uganda is still in the highest in terms of teenage pregnancies, and they have been escalated during the COVID-19 pandemic. So if we have policies like the school health policy, the adolescent health policy, and the other SRHR policies, they could help to combat but also improve planning for this country to ensure that at least the young people are able to access services and information about their sexuality, to be able to have informed decisions, but also to keep these children in school, but also to avoid many other issues like teenage pregnancies, which is at a high rate, but also the maternity deaths that we are experiencing.
Now, I'm curious to hear from you, as Sehad. We did see COVID-19 affecting different sectors, but of course it affected the health sector majorly. As Sehad, did you feel the government was doing enough to see that the most vulnerable were catered for? And even now that we're having the vaccination drives coming along, do you feel the health rights of citizens are being reflected in this entire process and respected as well?
I would say that at the moment we've seen quite good interventions and responsiveness, but when you look at the first phase of the pandemic, the situation was deteriorating. We lost very many mothers. And also when you look at the issues that we are having of teenage pregnancies, I think the government is doing interventions, but we need much more. And we take it back to the issue of resources, the issues of policies, but also working with other actors to ensure that these are kind of addressed. So we can't say the government has done nothing, but our call is that the government needs to invest more in healthcare, to invest more in finalizing these policies which can inform the programming and implementation to ensure that we get better healthcare. One other element I want to emphasize is that in the whole of the Eastern and Southern Africa, Uganda is ranked the highest in terms of out-of-pocket expenditure on health. Around 13.8, 15.3% of Uganda's population is spending the highest on out of their household income on health care, and it is far beyond the 15% recommendation by the World Health Organization, and it's something that we cannot really be proud of as a country. One of the recommendations in 2016, which government accepted again, is to ensure the passing of the National Health Insurance Scheme bill, but also ensure that it is implemented. We made very many efforts and worked with the government of Uganda to ensure that this bill was brought forward. And in the 10th Parliament, through working the Health Committee, this bill was passed. But now it's coming to our notice that again there were some reservations by certain private actors, but also by the government, and this bill is going to be retabled again. And we are really interested in this bill because when you look in the whole of East African region, it is only Uganda which is not having this mechanism. And why do we want the National Health Insurance Scheme bill? It is to help even the vulnerable populations, people in the rural communities, to be able to access health care.
Imagine
any given time. Because you see, we are saying we are adopting experiences and also practices by our neighbors in the countries, but you are not adopting the best practices, and this is one of them. While the private sector, they're having issues around the contributions, and the government is more into the private sector to address their issues. We are not saying that is bad, but we are saying that what is the role of government in ensuring that the grassroots person in the rural community far deep is able to access healthcare without having hardships. We've lost many lives because people are not able to access healthcare. So we want to also call upon the government that this is one of the bills which should be prioritized to improve access to healthcare and quality of care by the populations of this country.
Well, you end on the note of population, and I do want to move on to Dr. Betty Chadondo, who's the Director, Family Health National Population Council. I want to right away start. I'm curious to know what UPR means to you as the Director, Family Health National Population Council.
Thank you very much, Sandra. And my colleagues have already explained what the Universal Periodic Review is, and for us as government, of course, we are happy to be part of Universal Periodic Review, because it is always nice to know where you're performing well, where are the gaps, and then you draw the next steps to improve what you're supposed to deliver on. So this Universal Periodic Review, we are happy as government of Uganda to be part and participating fully, and we actually appreciate the different players, especially civil society organization that tries to hold government accountable to fulfill some of the obligations, of the commitments that we make, not only at national level, but also globally. See, we make commitments. As Uganda, we have our policies and strategies, as has been said by my colleague, Mr. Mhumuza, but we also make commitments at different levels. For example, in 2019, His Excellency the President was in Nairobi at the summit for the International Conference on Population and Development, and he actually made a commitment that constituted of 5 key areas, and some of these were health, others were development, others were ensuring that we support and reduce the violation of rights by supporting especially the girls and women to be able to access sexual reproductive health services, and also to avoid the negative cultural practices, which of course is mainly the gender-based violence and female genital mutilation. So as government, we are happy to be part of this process, and we appreciate when we are reviewed, and the review is an open process that engages all different sectors and players. So we do not deny the fact that there are loopholes or there are gaps in the commitments that we have done, especially those that are supposed to promote the rights of our people. And at National Population Council, our mission is to improve the quality of life of the people of Uganda, and definitely without promoting and protecting the human rights of our individuals, of our population, then we are denying them the rights. For example, one of the issues that Mr. Mhumuza has alluded to, this issue of teenage pregnancy. When you look at the drivers of teenage pregnancy, what are these girls looking for? It is not within their, it is not within themselves that they go out to get pregnant.
But the circumstances
around where they are living. Some of them are defiled, it is true, and COVID has shown us it is not pregnancy is not happening in schools but in the homes. But also, what are they looking for? They are probably looking for a safer environment, a better place to live in. They are probably looking for food. I think it was in 2018 where a study was conducted in the eastern part of Uganda, and especially in Busoga region, what is driving teenage pregnancy. And it actually showed that mothers are sending their young girls to go and look for sugar. But in the process of looking for sugar, they have to find someone to give them the sugar. And that is probably another, the other sex, the man or a boy giving them a quarter kilo of sugar, and then you have that in exchange for your body. This is very unfortunate, because it is either nutrition, they want to be feeding, it is either they are naked, they don't have enough clothing. It is these girls experiencing their menstrual periods and they are naked because they cannot dress up when they are having their menstrual periods. So this is a challenge, and it's a violation of human rights. So as government, we accept we are not doing enough. Maybe it is the finances that are not adequate. Government has tried, but probably there are loopholes that we need to plug. I must say the Ministry of Health has been spot on in some of these areas. For example, I really love, it is a long name of this strategy, the Reproductive, Maternal, Newborn and Child Health Strategy, which is, starts at global level, where we're supposed to ensure that the rights of every child and every woman are met. And then we domesticate it at country level. And there is a periodic review of what is happening in different countries, starting, of course, regionally, but across the globe. What has Uganda done? And one of the things that has been supportive of implementing this strategy is ensuring that we have a results-based framework to the strategy. So for every intervention, there is a finance, and this finance is being implemented, coordinated, and regulated at the service delivery point. So you go for a service, and there is a finance attached to the service you're receiving, and then the health workers actually receive. It is a results-based financing, but you receive like a reward for ensuring that you offer that service. This has helped in one way, and it has improved quality of care, and it has also attracted communities to access services, because now you find drugs are available. Of course, it may not be everything being the country that we live in, but this has greatly improved quality of care, and especially in districts where the rollout kicked off.
I wonder if Abdul agrees to that, but okay, carry on.
He will speak to it.
Yes. Well, I just also want to pick your thoughts on the population growth at the moment. We are hearing the teenage pregnancy, and generally Uganda's population is growing. What is the impact it is having on the health rights of citizens in this country? What would you say to that?
Just like Abdul Kalim has said, when we talk about the population, we are talking about increase or decrease in the number of people. But now if we are experiencing a high teenage pregnancy rate, especially because of COVID, of course we have always had a high teenage pregnancy rate, and we have been the highest country, the #1 country with the highest teenage pregnancy rate in the region, in the East African region, and I think in #3 in sub-Saharan Africa. So once we have teenage pregnancy, that means we have a high fertility, because our girls start, or our women start giving birth when they are young.
True.
And because they are not guided to use contraception, they continue giving birth more frequently than expected. So this drives the fertility. They are more fertile. They have, for right now, our fertility rate as a country is 5.4, and this is, maybe it is only Burundi that is higher than us at 5.7. But if you look at Rwanda, if you look at Kenya, even Tanzania has gone down to 5.1. So 5.4 means a woman in Uganda will have about 5.4 children, which is either 5 or 6, depending on where taking it from, in her reproductive life. And this is not good for the country, because are we able to support these children that we are bringing forth into this world, to be able to support them to access all health the different services, basic social services? Do we give them enough food? I have just said someone goes to look for a chapati or a quarter kilo of sugar, so that means there is no food in their home. Do we give them the basic health services? When they are sick, are we able to take them to the health facilities and they receive the care that they need? 3, are we able to educate them? We know even when schools are not closed, not every child that's supposed to be at school is in school, despite the universal primary education, universal secondary education. And this happens for a number of reasons. Some of them drop out because they are pregnant. Others cannot just progress because they feel, you know, there is stigma even within the school when they have grown bigger than the age they are supposed to be, or in the class that they are supposed to be, so to say. They are called parents. But now government is trying to address some of these concerns, but still government as a duty bearer needs to do a little more to support, promote, and ensure that the rights of our communities met.
Thank you so much, Dr. Betty Chadono, for that. You did speak precisely a lot on the population and its impact on health rights. And Abdul, you spoke about health rights. We did hear from Robert Scheringer on what UPR is. I want now to pick the thoughts of Priscilla Nyarugoye, who's from the Uganda Human Rights Commission. I want to believe that those watching us today have some questions to push your way, because we did just have the 2021 Uganda general elections, and we did notice some violations, blatant violations of the day. And if you're to look at a country that has been reviewed twice, you know, how are we performing in terms of ensuring that every citizen of Uganda is actually enjoying their basic rights?
I've already introduced myself. The Uganda Human Rights Commission has a mandate of promoting and protecting human rights in the country. And as the Uganda Human Rights Commission, we have a function. One of the functions is to receive and investigate complaints that are related to human rights violations. And when it comes to violations on around elections, we received a lot of them as Uganda Human Rights Commission and investigating those complaints.
There's always the talk of a general election comes on and it goes, and we never see people getting punished for their role in violating human rights of Uganda's citizens. What would you speak to that? Are you really doing this role actively?
Yes,
are we seeing these people getting punished?
We are. As UHRC, we investigate these complaints, and we have a tribunal that hears the complaints. But also the Uganda Human Rights Commission has a mandate of monitoring the human rights situation in the country and also making recommendations to government. I'll specifically talk about the right to health from the general elections. The UHRC receives complaints on the violation of the right to health, and we received a number of them. And also we review bills that are before Parliament to ensure that they comply with human rights standards. Specifically on the right to health, I'll talk about we've reviewed the National Health Insurance Bill, which was enacted but we're waiting to be assented to by the President, but also the Prevention and Control of the HIV/AIDS bill then, but now it's an act, and we highlighted various concerns in the act that were not in compliance with human rights standards, like for example the issue of criminalizing people that intentionally or willfully transmit HIV/AIDS. We had recommended to government to delete that section, but unfortunately the act passed with it. Then also the issue of disclosure of someone's results without consent, which is a very serious human rights concern. As UHRC, we had advocated for it to be deleted from the bill, and we are still advocating and pushing government to ensure that it reviews such laws in the country to ensure that all the laws in Uganda comply with human rights standards. But we also monitor the state of human rights situation in the country and make recommendations to Parliament.
We'll be speaking about the human rights recommendations, but a very big thank you to all our partners that have made this show possible. We have SEHED and also the National Council of Human Rights Defenders Uganda. We do thank you so much in partnership with SIDA. Thank you so much for being part of this conversation and for making it possible. But we are also curious to hear from you who's watching us this Friday evening. What are your general thoughts? You've probably heard about UPR for the very first time, and we know it happens every after 4 years. But if this is your first time, what are your thoughts on how your rights are actually respected? I did listen to a conversation where Mr. Scheringer, you were in it, and you talked about how people look at universal periodic review as something that is a big, complex subject, but it actually concerns the citizen at hand as an individual. And I want us to understand and help the general population understand, those that are watching us today, that UPR is something that we have to actively participate in it. But how then do we participate in it? I want to get back to you, Priscilla, and I want to pick your thoughts on your role exactly as a Human Rights Commission. Your role in UPR, what exactly do you do? You make recommendations, but again, after making the recommendations, when some recommendations are adopted, do you implement them? Do you work closely with the government to see that they're implemented, or does it only stay on paper? We've seen a lot of talk of people having conversations in conference rooms and they don't implement.
Thank you so much, Sandra. On the role of the UHRC in regard to universal periodic review, the Uganda Human Rights Commission as an institution that has an A status, we are a national human rights institution with an A status. We have a role of also submitting our own independent report, but also offering technical support to the government of Uganda as they develop their government report, and also offering input to the government report to the universal periodic review. But also we do, as an HRI, we're supposed to observe when it comes, like if you go to Geneva, the UHRC has that observer status. We observe the proceedings, whatever is happening, and also adopt or make a statement after the adoption of the report. But we also do that through consultations. When you're developing an independent report, we do consultations with all various stakeholders to ensure that we have all the issues captured in our report. When it comes to implementation of our recommendations, yes, it's true some of the recommendations have not been implemented by the government, but some have been implemented. Like the UHRC has been recommending government to review certain laws, like I've already mentioned the one for HIV/AIDS, to ensure that it complies with human rights standards. And also we made recommendations in regard to the amendment of the Children Act, which the government already did. They already amended the act to ensure that it complies with the CRC. Also we made a recommendation in regard to the budgetary allocation to the health sector in line with the Abuja Declaration, because the government of Uganda made a commitment to be allocating 15% of its resources to the health sector. And as UHRC, we keep pushing government of Uganda to make sure that they comply with the human rights standards that they committed to.
If you're to compare 2016, for some reason I keep taking you back to how we conduct our general elections, because that's clearly when we see complete violation of human rights. If you're to compare 2016 and 2021, would you say we are making progress in respecting the citizens' rights in this country?
To some extent, I would say yes. Government is doing something about it, but also another extent, to a greater extent, I think the government has not done much in regard to promotion and protection of human rights in the country.
You know, when we say to a greater extent and to a lesser extent, help us understand, to a greater extent, how are we ensuring that the citizens' rights are respected? And then to a lesser extent, how are we not respecting them?
I would maybe give an explanation in regard to the laws that the government of Uganda has enacted. Yeah. The government of Uganda, to some extent, has come up with different laws, but when you look at the implementation of these laws, it's still a great challenge. The government has to make sure it enforces the laws that has enacted, and also making sure that the laws that it enacts comply with human rights standards. We are glad that Parliament already came up with a checklist, to make sure that when they are passing their laws, they go through that checklist to ensure that the laws that they're passing comply with human rights standards. Yeah.
I'll move on to Mr. Robert Scheringer. On a number of occasions when you're having conversation, you keep on saying the state is a vital actor in the UPR process. Speak to us on that, on how the state can actively take part in the UPR and later see that enforcement or implementation of these recommendations are put in place.
Thank you, Sandra. So the state is actually the principal actor because the Universal Periodic Review is a state-driven. We, the rest, when I say we, civil society, UN country team, come in as key stakeholders, including the National Human Rights Institution. So that's why in the UPR working group, only states take the floor, other actors, but we contribute in terms now. One of the core obligations of the state under international human rights law is that it has a responsibility to respect, protect, and fulfill human rights. Although we are all supposed to contribute to the protection and promotion, but the primary responsibility lies on the state. So the UPR being a state-driven process, the state is seen as the main actor, and that's why its report is the one that is reviewed. The state under review is the state that is being reviewed, so their report is the one that we contribute in terms of saying this is what the state has been able to. But one thing we need to know is that the overall objective of the UPR is to see how we can improve on the human rights situation of our country. And such a diplomatic process that you don't go there to name and shame your country. You go there to say this is what we've been able to do in terms of our voluntary pledges, in terms of the commitments we agreed to make, and in terms of the recommendations that we supported. But we also have challenges, and these are the challenges that we are facing, and that invites what we call technical cooperation and assistance. That the state accepts, yes, this is an obligation I accepted to put, but I have challenges. COVID hit me hard, the economy was not doing well, and then technical cooperation comes in. But basically the whole thing is that it's a state-driven process, and we come in as key stakeholders, civil society, the National Human Rights Institution, the UN country team, to come and support the process.
Now, from where you sit, just taking you back to Priscilla's conversation, as a country from human rights defenders, Uganda, how are we doing? You know, and I want to also compare 2016 and 2021 in terms of how we're respecting basic human rights. Yes. Are we doing well?
Yes, it keeps fluctuating. And the fluctuation actually happens when we are addressing political questions.
True.
When we have an election. In 2016, when we had the last review, some of the recommendations under the UPR that which the country, the government of Uganda accepted or supported was to look into the violence, electoral violence, and bring the perpetrators to book. So in 2016, we had an electoral violence. I don't know what you witnessed in 2021, but I think you saw something close to that also. So at times it is one step forward, two steps backward. But the beauty about all this, and that's why at times you have to do some comparative studies, you realize that the mere fact that we can sit here, Sandra, and talk about these issues
is progress enough.
Is also progress. It's good. The mere fact that we are able to say, yes, the state is not doing this, and it acknowledges, is also progress. The whole thing is that what can I and you and any other person contribute to making this country a better place? There were recommendations that were made in terms of elections that they should make the appointment of the Electoral Commission, that's the Electoral Management Body, more public inclusive. That Sandra and I can participate in the appointment of a commission, as opposed to having only the president nominate commissioners of the electoral, so that it can be seen to be an independent institution that will manage elections. That has not been yet put in. There are also the recommendations, not the orders of the Supreme Court in the presidential election petition of 2016, where they said there were many reforms that would require to be done within the electoral management. Those have not been done. But as Priscilla said, that there's some progress has been made in terms of the human rights legal regime. We have what we call the Human Rights Enforcement Act of 2019. That's a very good law where if Sandra is in the police force or is in the military and she commits any human rights violation, you will be taken individually to the courts of law, as not the vicarious liability cover where most of them said, I was doing this in the course of my duties. So individuals are held personally liable for any human rights violations. The question is, how do we implement this law? We have a good law, but implementation is still a challenge. It's when the last...
From most of our conversation, implementation it's something that keeps on coming up. Yes. Why exactly are we struggling with implementing the wonderful laws that we have?
I think it all falls back to all of us, because we are all part of government. To what extent are you cooperating with the mechanisms? If Sandra is someone to come and testify in a court of law, are you willing to go? Are you willing to go and make a statement to the police? Or you are afraid, or you don't have the confidence in the criminal justice system? So it's a combination of many factors. The desk officer there, is he facilitated to do the investigations? You have seen where the policemen live in this country, their livelihoods. Do you think that he's able to wake up early morning and be able to go and carry out his duties? So it's a whole package of questions that we really need to do. But every citizen has a role to play in all this. You can't all throw it to government. You as a citizen, have you played your part? And when you play your part, then you can question whether the other person has also played his part. But implementation, as indicated, is still a challenge in this country. You have very good laws, but when it comes to implementing them, sometimes we have what we call the Access to Information Act. But how many offices can you go to in the ministries or department of agencies and say, I want you to give me an appointment letter of so-and-so? So he says, who are you to seek this information? But you have a piece of legislation that allows you to access such kind of information. But because either that person is not aware, is feigning ignorance, you may not be. So there may be also need for awareness and dissemination of these laws. Not all public servants are aware that these laws even exist.
Well, staying with you before we speak about the role of the CSOs, I want us to directly speak about the role of citizens, because once again you brought it up. How active can the citizens play, in this UPR process, for example? Would you say that as citizens we are failing ourselves at some point?
Yes, to some extent, because we have a legal regime. For example, the Constitution, Article 38 states that every citizen has the right to participate in the governance affairs of his or her country through either your elected representative or through your civic organization. So the question one would pose to an ordinary citizen, if you've seen certain rights being abused or violated, what have you done? You've talked about teenage pregnancies. These pregnancies don't happen in thin air. The perpetrators are there. You as a village, as a community member, what have you done to either sensitize these young men who continue to hold young, or big men who continue to hold young girls, including their own relatives? Or to what extent have you come out to report to the police when you see an old man trying to manipulate a youth or a young girl? Do you speak out? Do you come out? Or you say, that's none of my business, I'm going to focus on this? To what extent do you fulfill your own obligations or responsibilities as a citizen? So it's a two-way traffic. The state has its responsibility to respect, protect, and fulfill, but also as a citizen, your rights go with responsibilities. So it's important that citizens also pick up interest in this UPR. We are talking about how best we can improve the human rights situation of our country. So we all have responsibilities.
So where do they start from? I mean, we're having this conversation here. Where exactly, someone is watching and probably asking, where do I start from? We are talking about universal periodic review, but where do I start from as a citizen? How do I start?
First of all, you start by, do you know what your rights are? So when you know your rights, you demand them. And when you demand them, you defend them. So it's important to question certain decisions because you know your rights. But if you don't know your rights, you can't demand, neither can you defend what you don't know. So pick interest is what I'm trying to say. What are my rights? What are my obligations? What are my responsibilities as a citizen? You can't complain about a poor state of roads when you know that you have an obligation to pay taxes and you don't pay taxes.
So first pay the taxes and then say I deserve to have good roads and then demand them.
You can't say I have a right to a clean and healthy environment when you go throwing plastic cups and whatever on the road and you are failing on your business.
Yes.
You get it. So it's a two-way traffic. We all have rights, but we also have corresponding responsibilities.
Two-way traffic indeed. Now, as we almost come to the end of our conversation, I want to pick your thoughts, Mr. Abdul Karim Holmes. We know that UPR is a good opportunity for advocacy, and I want to imagine there are those recommendations, as Sehad, you have at the back of your mind to say to the government or to the general process to see that we improve the health rights of Uganda's citizens. What are your recommendations?
In terms of recommendations, and I want to again borrow the current situation of the COVID-19 pandemic for the 2 years. And I believe that as a country, it has been a learning process for us in terms of especially improving access to healthcare. Yeah. And you look at the kind of investments which have been put into managing COVID-19, but also as Sehad, we use laws and policies as principal tools for promotion and protection of the health human rights. And one of the approaches used is to ensure that is the integration of the human rights-based approach in the programming, both as civil society, but also in the government kinds of interventions. And we look at the elements of like participation, which Mr. Robert Scheringer was talking about in decision-making, for instance. And one of the elements also try to emphasize access to information and services. And when you get back to the recommendations, especially on sexual reproductive health and rights, there are certain elements which still the government has not appreciated, and we still are about the issues of values as a country. But then when you look at the experience we've had as a country, the high rates of teenage pregnancies, the high cases of sexual gender-based violence, all this stemming, when you look at the pregnancies we've had from teenagers, the element of access to information, as a country we are still in the zone where we don't appreciate the element that these young children, these teenagers need to access information about their sexuality.
True.
In 2018, the Ministry of Education passed the National Sexuality Education Framework. And just after that, the religious bodies questioned it again, and that was put back in the shelves that there are still issues that are against our values. But look at between 2018 and 2021, the cases we've had. The element of access to safe and legal abortion, that one has been a contentious issue for this country, and it has not been embraced. Why? We have had so many lives lost. Like I said, the 16 to 18 mothers we are losing per day due to maternal-related and issues which are preventable. 4 to 6 of these are as a result of unsafe abortions. And why we say that these young people need to access information, they need to access the services. We still have a gap in terms of access to family planning services. And Dr. Betty can attest to that, that there is still that fear that we don't want to let the teenagers, the young people access these services. But you've seen the catastrophes, the high rates of teenage pregnancies, the mothers we've lost. Imagine during COVID-19, we've had so many cases of sexual and gender-based violence. We've had very many teenagers getting pregnancies as a result of incest. And what do you imagine? A child has been impregnated by a father, by an uncle. And what happens when they get pregnant? They do clandestine abortions in the hiding, and you end up losing these children. There has been issues of rape across the 2 years, and that has been happening. But how do we have policies and regulations that can appreciate that there are issues that we need to work around to improve access to sexual reproductive health and rights? So we want to again emphasize that as a country, we need to embrace the issues that are affecting the young people, that are affecting women and all other groups. And we get out of the fear that why should these groups of people access this information, access these services. In the end, we end up spending a lot of resources to manage, for instance, the post-abortion care services. And also have an element whereby even the, for instance, the enforcement agencies like police, very many healthcare workers have been arrested while they're even just providing post-abortion care. But because some of the laws, the sections in the Penal Code Act, are criminalizing any attempt to procure or provide a service to access these, the services related to safe and legal abortion care. So we want to call upon government to ensure that these policies that can help, and again we are saying that let's invest more in the preventive measures.
We should stop being reactionary
services, because when you wait for the curative, we are going to spend more money in terms of addressing the health needs of the populations. So one of the areas is investing in healthcare. We need more financing for the healthcare. We want to emphasize the element of the National Health Insurance Scheme Bill. Let us adopt the best practices of our neighbors. But also, like Priscilla highlighted, the element of sections in the HIV, AIDS and Control Act which are criminalizing. The issues of consent, the issues of confidentiality are very key. And that's why we get back into the integration of the human rights-based approach. So we want to call upon the government, but also the issue of the citizens' participation, the element of social accountability. Of course, like Mr. Scheringer emphasized, that the citizens have a role to play. Yes, but we are doing our part to empower these communities. We work in so many districts as the center. We work with many district local level structures to ensure that we empower these communities about their rights and they are able to demand. But if we've empowered the communities, if they are demanding and then there is no response, then we're also wasting a lot of resources. So we want to ensure that we work together as different stakeholders, the element of access to information, access to services, but also the respect for the health and human rights of the citizens.
Well, thank you so much, Hamza Abdul Karim, who's the Senior Program Officer from SEHAD, speaking to us about the different recommendations that we as a country should adopt and actually implement to see that we have general health rights, the general health rights of the citizens are respected. Just, Priscilla, I want to really pick your thoughts as we conclude the show today. Your recommendations from where you stand to the government to see that the general rights of the citizens of this country are respected. What are those that you currently have on paper to see that moving ahead as people eye 2026, just taking you back to elections, a lot of these things are sorted. We don't see a repeat of the same.
Thank you so much, Sandra. One, I think the government of Uganda needs to make sure that it enforces the laws that it has enacted. That is very key. And also ensure that all the laws comply with human rights standards. And also the application of the human rights-based approach, like he mentioned, that is very, very key, because it's the surest way we will achieve development in the country, or even the right to health in the country, because there are great principles under the human rights-based approach of participation, which has to be active, meaningful, and also the principle of empowerment, empowering the most vulnerable, because if someone is not empowered, they won't be able to claim for their rights. So there's that issue of ensuring that people are empowered to claim for their rights, and also the principle of accountability, because the human rights-based approach identifies who the duty bearers are and who the rights holders are, and making sure that government is accountable in everything that it does. Then also the other one, still, I want to go back to the right to health. The government of Uganda needs to make sure that it complies to the Abuja Declaration, that commitment it made in regards to financing the health sector up to 15% of its entire budget, and also ensuring that the right to health is incorporated into the main chapter of the Constitution, because it's now in the national directive, the national, forgetting the name, but it needs to be put in the main chapter of the Constitution, which is chapter 4, the Bill of Rights, because there I believe it will enhance justiciability of economic and cultural rights, and specifically the right to health. I've already talked about, and also increasing the salaries of medical workers, and also making sure that we recruit more health workers in the country, because they are kind of overwhelmed.
Yes,
I think
and
we need to do that.
security authorities, so that they do their job very well.
And also making sure that it complies with the human rights standards, because as HRC, we monitor government's compliance with its treaty body obligations. So Uganda needs to comply to all the treaty body, the treaties that it has ratified, and also making sure that the laws are in harmony with the standards in those conventions.
Thank you so much, Priscilla, and thank you so much for being here. I just want in a second, Dr. Betty Chadodo, just in a second, as we conclude this conversation, what should be our take home?
I think for us, the take home, I want to take it from the overall development framework of the country and what must be done, because now the country is running the 3rd National Development Plan, and a number of brilliant ideas have been put in that plan, and one of them that has been discussed here is increasing information and increasing awareness of communities on a number of issues, and there's a whole program of community mobilization and mindset change, which is not only the responsibility of the Ministry of Gender because of a mobilization responsibility, but we also have a human capital development program, which is also multi-sectoral in nature, and it links what happens if education is doing well, what happens if health is doing well, what happens if gender is enshrined in all these different areas where human rights must be protected and promoted. So for the civil society, I think this is an opportunity for you to hold government accountable to ensuring that there are resources for some of these programs which are very key and pertinent for development of Uganda.
All right, thank you, ladies and gentlemen, for joining us this afternoon and helping us understand what the Universal Periodic Review is all about. Well, for me, all I can say is that as a citizen, know your rights, like we've had, and also do your role, and most importantly, defend and demand for them. Thank you so much for joining us, and this conversation can continue on our social media platforms. You can continue sharing with us your thoughts, and we'll be right there to interact with you on the same. I've been your host, Sandra Twinoblio.